Today's topic is sacroiliac pain. Have you ever heard anyone say, "Ouch, my sacroiliac is acting up"? I bet you probably have, though you may not have noticed. It is actually terminology that is used very widely, and you've probably heard it in certain television shows and movies and did not even realize it. A good example I can think of is The Jungle Book. Kaa, that big snake, talks about his sacroiliac joint. And then also in the TV show The Beverly Hillbillies, Granny Clampett once in a while will take a swig of the white lightning because her sacroiliac is acting up. The sacroiliac joint is the largest joint in the pelvis, and it is also the largest joint in the axial skeleton. The sacroiliac joint is where the spine attaches to the pelvis. If it's damaged, it can cause pain in the lower back and buttock. It is actually a very commonly overlooked diagnosis, even though approximately 15 to 20% of those individuals suffering from lower back pain have sacroiliac pain. Certain risk factors that will increase the probability that you develop sacroiliac problems: individuals who have had lumbar fusions, they lose motion in the lower back. That force or energy shows up in the SI joints and they can get breakdown of the SI joints. Pregnant women have trouble with the SI joints. Trauma where the pelvis is broken or even the spine can damage the SI joint. And the sacroiliac joint is a joint, meaning any process which can attack a joint can also attack the SI joint. So arthritises such as ankylosing spondylitis, Reiter's syndrome, you can get an infection in that joint. Metabolic processes can attack it, such as gout, or you can have a tumor in the bone which can eat into the sacroiliac. The sacroiliac joint is the largest shock absorber in the pelvis. So if it's damaged, you can develop pain in the lower back and buttock. When it is diagnosed by a physician, that physician is initially going to do what they call provocative tests. And these are tests or physical examinations which are designed to place stress on the SI joint. That is to localize the SI joint as the source of your symptoms. The physician will also use certain imaging techniques such as X-rays, which allow us to look at the SI joints, CT scans, which are more specific, X-rays, which allow us to see the SI joint in more detail, MRI studies, which allow us to see the SI joint, but also it allows us to see if there's edema, swelling, basically an active process going on that may indicate that is the source of the symptoms. A bone scan can also be useful because it will light up in the SI joint if there is difficulty with the SI joint. Treatment of the SI joint typically consists of activity modifications, medications such as nonsteroidal anti-inflammatory medications. Physical therapy is useful, and many times it will involve modalities such as heat, ice, TENS unit. An SI belt can be used, which is a sacroiliac belt designed to take stress off the SI joint, and it's very useful in pregnant women because pregnant women cannot take medication, they can't have injections, and many times they can't even engage in physical therapy. Injections are useful. Injections can be both diagnostic and therapeutic. Diagnostic in that if we inject the SI joint and the symptoms go away, we have then isolated that as the source of your symptoms. And therapeutic in that we can inject medication, which is a powerful anti-inflammatory medication, which may eliminate the inflammation, symptoms, and pain. Radiofrequency ablation can be used, which is a technique of burning the nerves going into the SI joint. Its main limitation is the fact that we can't reach the nerves that come in from the pelvis and supply much of the SI joint. If all of those conservative treatments fail, then you consider surgical intervention, and that's when you come see me. Surgery is classically divided into two types. You have open surgery and you have minimally invasive surgery. We do minimally invasive surgery of the SI joint. Initially, we place a needle into the SI joint. Over the needle, we drill large enough so that we can get a device into the SI joint, allowing us to inject a mixture of bankbone and stem cells. If we need to, we can place a metal device across the SI joint. This metal device is useful in stopping movement quicker, causing quicker pain relief, and increasing the probability that the joint will heal. This is an outpatient procedure. In most cases, you can go home the same day, certainly walking the same day. You need to watch our video from the point of view of the surgeon, and it shows everything. It should answer most of your questions. If it doesn't answer your questions, feel free to write me at drsmith@elpasospinecenter.com. And the most important thing is, don't forget to give us a like and subscribe. Oh, and tell your friends and neighbors to watch us. I'm watching you. Thank you.
Every change